The information provided during the following program is not intended as a substitute for medical advice. Personal health concerns should be brought to the attention of your health care provider.
Health Talk is brought to you by Cablevision in association with the Sound Shore Medical Center. Your hosts are Pat Pingatori, a registered nurse and director of the hospital's community relations, and Sal Shalero, director of media relations. Stay up to date on the latest medical topics coming up on Health Talk.
Welcome to Health Talk. I'm Pat Pingatori.
And I'm Sal Shalero. What happens when the veins in our legs are not healthy? Here today to talk about venous insufficiency and varicose veins is cardiovascular and thoracic surgeon Dr. Arlen Fleisher. Dr. Fleisher's practice is in Hartsdale, New York, and is affiliated with Sound Shore Medical Center. Dr. Fleisher, thank you for being with us.
Welcome.
Thank you for having me.
Begin, please, by explaining the venous circulation of the leg.
The vascular circulation of the leg is broken down into arteries and veins. The arteries bring blood to the legs, and the veins take blood from the legs back to the heart. And there are two sets of veins in the leg. There are deep veins and superficial veins. The deep veins run inside the muscle, and they're responsible for taking 95% of the blood back to the heart. The superficial veins run underneath the skin and the fat, and they're not responsible for much of the circulation of the legs at all, less than 5%. So they're not important as far as the venous circulation of the legs go. And the veins are basically tubes. And because they are tubes, they have little tiny valves in them every couple of inches down. And the purpose of the valves is to prevent blood from going backwards when you stand up. Because of gravity, when you stand up, the heart's up here, the legs are down there. All the blood would go down to the feet if these little tiny valves didn't stop blood from going backwards.
That's a pretty good idea.
So our feet and our ankles would be like this.
Right, there would be nothing to stop it. And when you walk, the calf squeezes and it shoots the blood back up to the heart. The calf's considered almost like the heart of the legs. And when these valves are functioning well, there's no blood going down. And the circulation is going in the right direction, from the arterial circulation to the venous circulation back to the heart. When the valves become non-functional or dysfunctional, that leads to problems of the legs.
Define the term venous insufficiency. I assume that's what some of these valves are involved in.
Exactly. The venous insufficiency refers to basically the functions of the valves. So when the valves are what we call incompetent, so they're not working, it's creating what we call venous insufficiency. What venous insufficiency is blood going backwards down the venous circulation. So when the valves become incompetent and they're not closing 100%, blood goes backwards in the superficial. It's usually the superficial venous circulation. The deep veins are usually intact. And this causes an increased pressure within the venous circulation. And that increased pressure is responsible for the symptoms of venous insufficiency.
Is this a common thing?
It's extremely common. There's probably 30% of the population is affected by venous insufficiency in one way or another.
Mm-hmm. And who is at greater risk for this condition?
Well, it's a genetic disease, so it's hereditary. And but women are more commonly affected than men because of pregnancy and because of hormone changes. But men are affected significantly with this disease, although, in the general public it's considered, a quote-unquote women's disease.
We probably know it as something other than venous insufficiency. What's the common term, and what are the symptoms?
Well, people really refer commonly to venous insufficiency as varicose vein disease. And varicose veins are those big, ropey veins that you see on people's legs. And that's what most people think about. But it's a little bit more complicated than that, because patients could have venous insufficiency and not have varicose veins, but have other symptoms such as leg pain, achiness, swelling, skin changes of their legs, lots of itching, and people are not really thinking about that as a venous vascular problem, because they don't actually see the big varicose veins. So about 20% of patients don't have varicose veins who have venous insufficiency.
people who are on their legs a lot, who do nurses or someone who's out walking a lot, or would they be at greater risk for developing this, or would that help them actually because of the movement?
Well, the walking helps. What is very important is having good calf musculature. That helps prevent venous insufficiency.
Calf muscular what?
Calf musculature. So in other words, if the calves are well formed and you're working, so doing lots of walking, running, that's going to help. If you have vascular disease, venous vascular disease, it will make it a lot less, and it may actually prevent it in some patients. Mm-hmm. Patients who stand for a long time, that increases the risk of having venous insufficiency.
So it's standing more so than the mobility or the movement.
Yeah, especially it's a higher risk in, say, factory workers who are standing all day in one position on a very hard floor. Mm-hmm. That's one of the risk factors.
Oh, okay. And would age be another risk factor?
Not necessarily. I mean, you know, as people age, if they have venous insufficiency, it's going to get worse, but it's not something that will necessarily develop as you get older.
So you can have it when you're younger?
Yes, it's very common.
I see quite a few young people
it's very common
with that condition. Yeah.
So now, how is a varicose vein different or same as a spider vein?
That's a good question. A varicose vein is a large ropey vein that you see on the leg, and it's usually associated with an incompetent, you know, a great saphenous vein or a small saphenous vein. Those are the two main superficial veins in the leg. Spider veins are those little tiny bluish veins that people have on their skin, and that's very common, especially in women. It's something that's not considered a medical condition if it's not associated with underlying venous insufficiency.
It's not in the calf, not in the same place as a varicose vein?
No, it can be, but it's usually in women, it's usually on the outside of the thigh is a very common spot, sometimes down on the lower leg. And if it's associated with venous insufficiency, then the venous insufficiency would have to be corrected before the patient gets the spider vein treated.
Is it painful, this varicose veins condition, or do people just remove it because for aesthetic reasons?
Well, varicose veins are a medical problem, and that's why it's covered by insurance. There's lots of misconceptions about varicose vein disease. A couple of it's a woman's problem. It's cosmetic. They come back. All of these old misconceptions are not true. It's a cosmetic problem in the fact that, you know, they're not particularly attractive when you look at the legs. People have large varicose veins, but it's a medical problem because it's created by a problem with the veins of the legs. The veins are incompetent, and they're like 99.9% associated with symptoms, and that's the reason why it's a medical condition.
Now, a lot of people, I mean, if you look at your skin, you probably can see a bluish underneath where the veins are. Is that a varicose vein, or do they have to be like gnarly and
popping
like
out?
Yeah, protrusion. I mean, you see that in some people, or is that just the worst case scenario?
Yeah, no, some patients, very thin patients, you can see a lot of their veins because they don't have a lot of subcutaneous tissue. Mm-hmm. And there are spider veins. Those are the little tiny veins you see on the leg. There are varicose veins, which are the big gnarly veins, and then there are those little other bluish veins, bluish greenish veins that we call reticular veins. Now, if they're associated with spider veins, then they get treated as a incompetent vein. We usually inject those veins. But in a normal person, without just a thin normal person, you may see veins, and that's normal variation.
What are some of the reasons a person would come to you suspecting that they may have a problem with venous insufficiency? Just looking at it, or are there other things?
Well, patients will come if they have, first of all, they'd probably see veins that are popping out. Their legs would hurt. They'd have achiness.
So it is painful.
They'd get swollen at the end of the day. They'd have leg cramps at night or leg cramps during the day. They'd have to rest frequently, elevate their legs. Some patients will have like very itchy legs, and that's secondary to the veins and the high pressure in the veins. It causes the release of histamine in the tissue, and that's what causes the itchiness and swelling. Sometimes patients will see skin changes because the end organ of the vein is the skin. And what ends up happening when the blood starts to back up, the blood starts leaking out of the vein when the pressure is very high, and there's hemoglobin in the blood, and that gets trapped underneath the skin, and that's what causes the skin discoloration.
And it's always in the calf, or is it other parts of the leg, other parts of the body?
It's in the lower extremity, so it's in the leg. Its most common part is in the calf, but it could be any place in the leg. And these patients are severely symptomatic. Lots of times, I have lots of patients, they go see their doctors, and one of the problems with varicose veins is that in the past, they were difficult to treat, and they were difficult to diagnose. So when patients got treated, they had to have a vein stripping operation. They had to go to the hospital, stay there for a couple of days. They were not able to move around for anywhere between 4 and 6 weeks, and lots of times the veins came back. And the reason for that was because back in the old days, before we had ultrasound, which really makes the diagnosis and you know what vein to treat and what's leaking and how to treat it, just one vein, the great saphenous vein, which was the most common vein that caused the problem, was stripped out. So if that was causing the problem, the patient got better. If that wasn't causing the problem, which happened in maybe 40 to 50% of the time, the veins came back and the patient's symptoms were back. So the doctors were very hesitant to send patients for surgery for that. They go, look, you know, this is something, you're not going to die from this, just forget about it. And then they were reluctant to send patients for the procedure.
Is there something that can be done between just forget about it and surgery? Is that any kind of treatment that you could prescribe that would alleviate the condition?
Well, the first line of treatment for taking care of venous insufficiency and varicose veins are compression stockings, surgical compression stockings, and these are very tight.
Unsightly.
Well, they have new stockings now that really aren't.
They come in colors. You look good.
Unsightly.
They got a good color. You look good in a.
Oh, they do. They come in all different colors now.
See?
And they come custom made. And actually,
He probably sells them.
well, it's one of the services that we provide, being a full service vein center.
Well, yeah, yes, because you have to be measured for them and they have to be done correctly.
Yeah, we provide it,
Yeah.
and patients can get them there if they want. But I write plenty of prescriptions for patients.
And you have to wear these all day, every day?
You don't have to wear them, but they'll help with symptoms. They're very difficult to put on in some patients, especially elderly women who have arthritis, and they're uncomfortable, and they're hot, and in the summertime, patients don't want to wear them. So, but that will help with alleviating symptoms, and that's actually one criteria that insurance companies need before they'll let patients, or before they'll approve the procedures, to make sure a patient will want compression stockings. But the compression stockings don't cure the disease, they don't treat the disease, it still progresses. So it will just be something that will give patients a little bit of comfort.
Okay. Don't you go away. We got more questions for you. Don't you go away either. We'll be back in 2 minutes.
Two out of 3 people with diabetes die of heart attack or stroke. That was his wake-up call. This is yours. Ask your healthcare provider how you can lower the risk. To learn more, go to diabetesactnow.org.
Folks, why won't we go to the doctor? My uncle called, speech all slurred, complaining his arms numb. He called everyone. He even called my daughter Tiara, because, you know, she's got a year of nursing. Everyone thinks he needs to go to the doctor, including me. So he said, well, will you take me? I'm like, I'm on the road. He goes, I'll wait. Stroke's no joke. If you or someone you love have symptoms of stroke, don't wait. It may be too late. Dial 911. Time loss is brain loss.
The smallest moments can have the biggest impact on a child's life. Take time to be a dad today.
Welcome to the Maya and Miguel Challenge. Meet Maya in the game.
Oh, hi, I'm Maya.
Maya and her friends want you to get up and play, because it's always more fun to be active.
Let's get started.
Just go to letsmove.gov and look for Maya and Miguel. You'll find tons of fun activities that'll help keep you healthy and active. Whether you play sports, run, dance, or jump in place, just get up and play at least an hour a day. Take the Maya and Miguel Challenge today at letsmove.gov.
Welcome back to Health Talk. I'm Pat Pingatore.
And I'm Sal Shalero. Today we're talking with Dr. Arlen Fleisher about conditions associated with the veins in our legs. Dr. Fleisher is a cardiovascular and thoracic surgeon. His practice is in Hartsdale, New York, and is affiliated with Sound Show Medical Center. Off camera, we were talking about the cramping that many people get in their calves. Now, does this have anything to do? Yeah, well, mostly at night you wake up with these sharp pains in your calves. I guess most of us have experienced this. Does this have anything to do with the conditions we were talking about earlier?
It can if it's something that happens over and over again. And I just want to go back and explain a little bit about the anatomy of the legs again to make it a little clearer. The veins, the superficial veins, I'll talk about the great saphenous vein now because it's the most common vein that is incompetent. That vein runs from inside of the ankle into the groin. It's the longest vein in the body, and it runs underneath the skin.
What's it called?
The great saphenous vein. It runs underneath the skin in the fat. And when that's the vein that becomes incompetent. And when it becomes incompetent, the veins that you see bulging out of the skin, the big bulgy veins, are tributaries or branches of that vein. It's not the actual vein, but it's branches of it that actually everybody has in their leg, but when the vein becomes incompetent, the pressure in the vein becomes so high that when the blood starts backing up, those veins start popping out over the skin, and those are the veins that you see. So with leg cramps in patients that commonly present with that, we would do a screening ultrasound on them, and the reason why is because if it's caused by an incompetent vein, and if it's a symptom of venous insufficiency, it's something that can be easily treated. It may not be, but it's worth ruling it out as an etiology of that disease.
What else might cause it?
Leg cramps, dehydration, inflammation in the muscle, stretching when you're asleep for some reason. There are lots of causes, and lots of times patients come in and they think they have with different kinds of leg pain. And the other thing is that the pain for venous insufficiency can masquerade as other diseases. I've seen a lot of patients referred from orthopedic surgeons who had patients that had knee pain, and they'd scope their knee and the knee pain wouldn't go away. We would scan them, find they would have an incompetent great saphenous vein, and close the vein, and their pain would go away. So there are lots of different symptoms that aren't typical of venous insufficiency that could affect the leg that